Mr. President.
The senator from Colorado.
Mr. President, I'm aware that the time is at an end, and I wonder whether I could ask consent for 7 additional minutes.
Without objection.
Thank you, Mr. President, and I'd like to thank my colleagues from New Mexico, my neighbors, for being here, and I also want to thank the presiding officer for your statement. As usual, you're pointing the Senate in a direction that we should be headed. Whether people in my state support the Affordable Care Act or whether they don't, they're dissatisfied with the way our health care system works. And the Affordable Care Act or Obamacare or whatever you want to call it, that's just part of our health care system. We have Medicare, we have Medicaid, we have hospitals, we have doctors, we have nurses, and it all adds up in America in the 21st century to a system that is really hard on people and makes it very hard for them to predict their future. And it creates situations where they have to make choices that no other people in the industrialized world have to make about raising their family, about staying in a job, as the presiding officer was talking about, that they might not want to stay in for fear they would lose their health insurance. I thought you made an excellent point. I thought the presiding officer made an excellent point when he said that you don't lose your car insurance when you leave your place of business for another job. Why should you lose your health insurance? Why should you? Why should you have to put up with things in this country that nobody else in the industrialized world has to put up with? And it may be that the debate that we're going to have is as binary as the presiding officer was saying. Maybe it's a debate about single payer versus what he described as more consumer-based. Maybe there's something in between. America has a way of trying to figure those kinds of things out, or at least we have historically. My other colleague from Oregon earlier quoted the famous line when somebody yelled out to Ben Franklin, "What kind of government are you creating, a monarchy or a republic?" That was the question. And his answer, as the senator from Oregon said, was a republic if you can keep it. If you can keep it. Because the founders had extraordinary vision, and they were creating something that had never existed before in the history of humankind. Never existed. You could make an argument, a couple of small principalities or places in Switzerland, and there would be some argument about ancient Rome. But really, this exercise in self-government sprung from their imagination and their desire as human beings to govern themselves, to slough off the monarchy that ruled them and ruled others in Europe. But what Ben Franklin said was so important and so wise, because he didn't say a republic. He said a republic if you can keep it. They were creating, when they wrote the Constitution, a mechanism for the American people to resolve their disputes. They were not creating a republic where they believed that everyone would agree with each other. They had vast disagreements. They had disagreements far greater than the ones we have. They had geographic disagreements. They had disagreements about big states and little states. They had disagreements about slavery. But they were able to come together and create a mechanism to resolve our differences. They didn't believe, as some people seem to on talk radio every day, that if you don't agree with the other person, that you must be a communist or you must be some right-winger. That's not what they believed. They believed there was a public purpose, that there was public virtue that underlay the work that they were trying to do, and that we would only be able to persist in this republic if we kept it. If we kept it. That's how self-government works. It's not a king telling you what to do. It's not the generation of the founders telling you what to do. It's doing what you need to do. And as the presiding officer said, for the sake of people who did their jobs before us, but more important, as he said, for the people that are coming after us. And seen from this perspective, this process is a disgrace. This is why we have a 9% approval rating in the United States Senate. What's been referred to in past generations as the greatest deliberative body in the world. Those words are spoken mockingly today. And the people I represent and the people the presiding officer represents are paying a price for this. Somebody asked me back, it's been a long time since I've been in the majority, but there was I'm sad to say, but it's true. But there was a time when I would preside, like the presiding officer is doing today. And a reporter asked me once, what do you think about when you're up there? Because as John McCain said the other day, we aren't doing anything here. He's right, we're not. So the reporter said, what are you thinking about? You know what I told him? I said, what I think about is, what is China doing right now? While Democrats and Republicans here have their fight that has nothing to do with the people that we represent. Well, we know what China's doing right now. While we don't even have the decency to maintain the assets and infrastructure, the roads and bridges that our parents and grandparents had the decency to build for us, starting on this floor, they're building trains not just in China, but all over Asia to bind them together in an economic union to come after the United States. What's China doing? And what I deeply regret about this debate is the end product, whether we pass this bill or whether we don't, is not going to improve health care for the people I represent. And again, my starting point is, there are people that like the Affordable Care Act, there are people that don't like the Affordable Care Act, but everybody is deeply dissatisfied, as they should be, with the way our health care system works. And what we should do is abandon this process and instead go to committee. My chairman, Chairman Alexander, he's a Republican, perfectly capable of running a bipartisan process that could lead us to a place where we actually are making things better for people who live on the eastern plains of Colorado or in the Front Range of Colorado or on the west slope of Colorado, who may be Republicans and Democrats, but for whom health care is not political. It's about their family and about their future. And that's what we should be keeping in mind instead of just the next election around here. Everybody has lamented that. And I'll finish. I know I'm coming out of time, Mr. Chairman, but I remember when the majority leader was not the majority leader. He came to this floor. He's a smart person. He's a smart person. And he came here and he said, quote, major legislation is now routinely drafted not in committee, but in the majority leader's conference room, and then dropped on the floor with little or no opportunity for members to participate in the amendment process, virtually guaranteeing a fight. That's what he said. That is what he said. And I am telling you, to those of you that I was in town hall meetings with 7 years ago, when people were saying, read the bill, the Tea Party was at the height saying, bringing pocket constitutions to my meeting, telling me be faithful to that process. I say we should be saying that right now. Be faithful to that constitutional process. He knew that the process wasn't working as it should. And what he said was, quote, when Democrats couldn't convince any of us, that is Republicans, that Obamacare was worth supporting as written, they decided to do it on their own and pass it on a party line vote. He's continued, it may very well have been the case that on Obamacare, the will of the country was not to pass the bill at all. That's what I would have concluded, he said, if Republicans couldn't get a single Democrat vote for legislation of this magnitude. I'd have thought maybe this isn't a great idea. So I say to the Republicans and Democrats that are here today, maybe it isn't a great idea. because they can't even get the Republican votes. They haven't gotten one Democratic vote. They haven't gotten the Republican votes to repeal and replace, even though they've run on this for 8 years. They had to bring the vice president here to cast the deciding vote because we were tired. What a shame for the Senate not to do its work and to rely on the executive branch to come here and supply that vote. And every single person in this body knows the President of the United States has no idea or interest what's in this legislation. Every single person here knows that. So why are we doing it? We're doing it, I guess, to fulfill a campaign promise to repeal Obamacare. And I can understand why there's pressure for people to do that, because they've said that over and over again, even though I disagree with their characterization of the bill, I disagree with the facts that they presented. I understand that impulse, but I don't understand the impulse of writing a bill in secret, not having, listen to this, folks, not having a single committee hearing. Not one committee hearing in the Senate. Talk about read the bill. How about have a bill that's written down on paper so we can read it? Where are my brethren in the Tea Party that wanted to read the other bill? There was a bill then. There had been a bill for a year and a half. There's no bill. There's no bill. Because what they're trying to do is figure out what they can eke out across the line here. They're calling it skinny repeal. I don't even know how that satisfies the laugh test when it comes to the campaign promises that were made around here, but that's not my issue. But we should just stop. We're at 9%. This bill, I think, Mr. President, the last time I checked it, we had a 15% approval rating or a 20% approval rating. Don't pass that. We've wasted 6 months, not of our time, but of the American people's time. I've got people all over the state of Colorado that would love to come here and testify at a committee hearing about how health care is intersecting their lives, how it's making their life difficult, or how they're benefiting from certain things. And I'd love them to have the chance to come here and testify. But we haven't set up that process. We should. We should stop this. The American people would be relieved if we would stop this partisanship, get together and work on the committee as we should do, and pass something on the floor. What's forgotten about the Affordable Care Act is that even though it didn't have Republican votes, and it should have, it had almost 200 Republican amendments adopted as part of the process. And I agree with what the majority leader said then. You know, if the process is lousy, the outcome of the bill is likely to be lousy. And, important point he made, it's unlikely to reflect the will of the American people. And when it doesn't, what it's going to mean is we're just going to continue to seesaw from one election to the next election. And we're not going to get a result. I am willing to settle for 80% of what I want, or 70% of what I want. I am. I don't think that's an unvirtuous position to have. All these people here all the time talking about the principle they're standing on. When you scratch at that and look for the content of the idea underneath that principle, there's very seldom anything there. They're often repeating something they heard last night on Fox or MSNBC, but it wouldn't be recognizable to the founders as a principle. And for them, a fundamental principle is that you had to unleash the imagination of people with different sets of experiences, different sets of opinions, different geographic places in order to do the right thing for this country. And that's what we should do today. And I realize the indulgence of the presiding officer. I thank him for his kindness. And with that, I yield the floor.